A zoonosis is an infectious disease that is transmitted between species from animals to humans. Zoonosis can be classified according to the etiology agents, which are the virus, bacterial, parasitic, mycotic, or unconventional. Zoonosis can be divided to four categories, which are direct zoonosis or orthozoonosis, cyclozoonosis, ferrozoonosis, and saprozoonosis. Here, we will be discussing about the impacts of zoonosis, especially on the infected animal, infected human, food industry security and safety, human life, the impacts on clinical system, the impact on human traveling and globalization, political system, and also on how to prevent the disease.
The first outbreak of the Nipah virus disease occurred in Malaysia from September 1998 to May 1999, affecting pig farmers and their families in several stages. The outbreak resulted in 265 human cases and 105 deaths, with a case fatality rate of about 40%. The outbreak also caused significant economic loss for the pig industry, as more than 1 million pigs were culled to control the spread of the virus. The source of the outbreak was traced to fruit bats, which are the natural reservoir of the Nipah virus. The virus was transmitted to pigs through contaminated fruits or direct contact with bat excretion, while humans get infected through direct contact with infected pigs or their tissue. The Ebola virus was first detected in a village near the Ebola River in 1976 at Zaire. According to the World Health Organization, in 2014, a major outbreak of Ebola began in West Africa. This outbreak affected 10 countries, mainly Guinea, Liberia, and Sierra Leone. It was the largest and most complex Ebola epidemic ever recorded, with a total of 28,000 cases and 111,000 deaths recorded, with a total of 28,000 cases and 111,000 deaths. This outbreak was caused by the Zaire Ebola virus species, which has the highest case fatality rate of about 50%. The cause of this outbreak is believed to be a 1-year-old boy from a small village in Guinea who was infected by bats in December 2013. He died a few days later, and his family and neighbors also became sick. The disease then spread to other parts of Guinea and neighboring countries. The disease was first detected in Wuhan, China in December 2019 and soon spread to other countries around the world. The World Health Organization declared this outbreak a public health emergency of international concern on 13 January 2020 and a pandemic on 11 March 2020. As for 16 June 2023, more than 768 million cases and nearly 7 million deaths have been reported worldwide, while 5 million cases and 37,000 deaths confirmed in Malaysia. The cause of the COVID-19 outbreak is still under investigation, but most experts agree that it originated from a new strain of coronavirus called SARS coronavirus 2 that may have come from bats or pangolins. Regardless of the severity of a disease outbreak, loss of human life is always inevitable, even with a virus like COVID-19, which has a relatively low fatality rate. its ability to spread through the air has claimed the lives of 7 billion people within 5 years. Behind these cold numbers lie strengthened families. The outbreak of the COVID-19 pandemic will certainly not be the last purge in human history. We can only hope that before the next pandemic or epidemic arrive, we can be better prepared. Infected pigs may experience tremors and muscle spasm throughout their bodies. These involuntary movements can manifest as shaking, trembling of the head, limbs, or the entire body. Pigs with a mild infection may display ataxic symptoms such as an unsteady gait, stumbling, or difficulty maintaining balance. Respiratory symptoms of Nipah virus disease in pigs often be coughing, sneezing, and are usually accompanied by severe nasal discharge. Nipah virus infection during pregnancy can result in the termination of pregnancy leading to abortion. Infected sow may experience spontaneous abortion where the pregnancy is terminated before the expected gestation period. In addition, the Nipah virus can cross the placenta and infect the developing fetus. The virus can directly affect the health and viability of the fetus, leading to their death during or before the gestation process. Infected primates can experience severe illness and die suddenly in most cases. Once the Ebola virus enters the body, the virus starts to damage blood vessels and impairs the body's clotting ability, leading to uncontrolled bleeding. This condition is called hemorrhagic fever as it is always followed by severe fever. Multi-organ failure is the main cause of high mortality in primates affected by Ebola. Ebola can impact the kidney and liver, impairing their normal functioning such as filtering and detoxification, and further exacerbate the overall condition of the infected primates.
What is zoonosis? Zoonotic diseases are caused by harmful germs like viruses, bacteria, parasites, and fungi. These germs can cause many different types of illnesses in people and animals, ranging from mild to serious illnesses and even death. Animals can sometimes appear healthy even when they are carrying germs that can make people sick, depending on the zoonotic disease. How does it transmit? There are at least 5 things you gotta know. First is direct contact. Coming into contact with saliva, blood, urine, mucus, feces, or other body fluids of an infected animal. Examples including petting or touching animals and bites or scratches. Second one, indirect contact. Coming into contact with areas where animal lives and roams, or objects of surfaces that have been contaminated with germs. Examples include aquarium tank water, pet habitats, chicken coops, barns, plants, and soil, as well as pet food and water dishes. Third one is vector-borne. Being bitten by a tick or an insect like a mosquito or a flea. The next one is foodborne. Eating or drinking something unsafe, such as unpasteurized milk, undercooked meat or eggs, or raw fruits and vegetables that are contaminated with feces from an infected animal. Contaminated food can cause illness in people and animals, including pets. Last but not least, waterborne. Drinking or coming in contact with water that has been contaminated with feces from an infected animal. Who is at a higher risk of serious illness from zoonotic diseases? As you know, anyone can get sick from a zoonotic diseases, including healthy people. However, some people are more at risk than others. These people are more likely than others to get really sick and even die because of it. These groups of peoples include children younger than 5, adults older than 65 years old, people with weakened immune system, and pregnant women. What could we do to prevent them from spreading? First, keep hands clean. Washing your hands right after being around animals, even if you didn't touch any animals, is one of the most important steps you can take to avoid getting sick and spreading germs to others. This is because many germs are spread by not washing hands properly with soap and clean running water. If soap and water are not readily available, you can use alcohol-based hand sanitizer that contain at least 60% alcohol. This is because hand sanitizer does not get rid of all type of germs, so it is still important for you to wash your hands with soap and water if they are available. Another prevention step for us to keep them from spreading is to know the simple thing you can do to stay safe around pets. To prevent bites from mosquitoes, ticks, and fleas, learn more about way to handle food safely, whether it's not for yourself or your family, your pets, and other animals. Be aware of zoonotic diseases both at home, away from home, such as at petting zoos or other animal exhibits, in childcare settings or schools, and when you travel. Last one is to avoid bites and scratches from animals.
Other than that, economic loss in the food industry. Livestock is one of the sources of food for human consumption. From this point, livestock disease, especially zoonotic disease, have direct consequences for national economic development. This is because they reduce the available supply of needed food, especially high-protein food. Feedstock of grain byproducts, and animal byproducts are waste when the animals consuming them die. The additional expense areas from surveillance mechanism for detecting animal reservoirs, diagnosis of animal disease, quarantine of animal, restriction on animal transports, inspection of meat and milk, and condemnation of animal products. The impairment of animal production by disease forced many countries to import milk, meat, leather, wool, and other animals products. This drains foreign exchange needed for development. On the other hand, countries that have animals and animal products that could be exported to earn foreign exchange may find their markets closed or restricted because of endemic infection, including several zoonoses. For example, E. coli 0157, Salmonella, and Campylobacteria are found in meats, eggs, vegetables, and others. As a result, many cases of death are reported due to food poisoning.
In regions where pig farming is prevalent, Nipah virus outbreak can lead to the culling of infected pigs to control the spread of the disease. This can result in a significant reduction in the pig population and disrupt the pig farming industry. Trade restriction on livestock and livestock product for sure are a non-negotiable matter from the region affected by the Nipah virus. Fruit bats are the natural reservoir of the Nipah virus. They can contaminate fruit trees with their saliva and excreta. As a precautionary measure, farmers may need to implement practices to minimize bad present in orchards, such as netting or covering the fruits, which can increase production costs. During Ebola virus disease outbreaks, restrictions are often imposed on the hunting, sales, and consumption of bushmeat as a preventive measure to reduce the risk of disease transmission. These restrictions disrupt the bushmeat trade and can lead to economic hardship for local hunters, traders, and communities that rely on this source of food and income. In addition, bushmeat hunting and consumption are deeply rooted in the cultural practice and traditions of many communities. Restriction on bushmeat can also disrupt local cultural practice, affecting social cohesion and community dynamics. The transmission of the Ebola virus through the handling and consumption of bushmeat has raised concern about food safety. The Ebola virus is known to be present in certain wildlife species, and unsafe handling and consumption can pose risk of disease transmission to humans.
Impact on human life. Humans must avoid and be cautious when socializing with other humans, which might carry harmful disease. Zoonosis have a negative impact on both human life and well-being. The affected person face obstacles that have a detrimental influence on their work performance and hence their ability to support their families. These circumstances are more common in developing African and Asian countries. In some situations, impacted persons may become isolated from the rest of the community, increasing their risk of developing mental health difficulties. Patients suffering from disease require specialized care, costly medication, and are a general strain on the healthcare system, particularly in the developing nations. As a result, local communities had to go through different methods of safely and dignifiedly interring their loved one. While it was not an overnight success, the number of diseases caused by corpse handling decreased dramatically. Lastly, social activities will not be allowed when disease occurs.
Next is the impact on clinical system. Many zoonotic diseases cause serious illness and high mortality in humans. The presence of zoonoses in a community has economic repercussions as a result of the need to provide health services like hospitals, diagnosis, and other laboratory services. The loss of human efficiency and man hours together with medical costs of control in zoonotic disease affect the national economy severely. This is because the country has to pay a very large amount of money to build hospitals and buying medicines and also vaccines to treat people and animals affected by zoonotic disease. In addition, they also have to pay fairly high wage for employees who work overtime due to the lack of manpower. For instance, immunosuppressive disease such as AIDS and zoonotic pathogens like bovine tuberculosis might assume more devastating nature and spread more rapidly.
Thank you, Elisa. Assalamualaikum. My name is Nuhumaira Atira binti Shazlan with matrix number 065583. Today, I will be talking about the impact of zoonosis from the perspective of travelling. Travel plays a significant role in the emergence and spread of zoonosis by it decreases the period of transit time in the same distance during tourism and migrations. It also creates impact which cause quarantine on its people. For example, during the spread of COVID-19, which is an infectious disease caused by new strain of coronavirus. Lockdowns or quarantines at the largest scales in human history have imposed by the governments around the world to control the spread of the pandemics. The consequences of this pandemic could change many aspects of human life and businesses, including tourism management, as almost half of the global population adopted to the restriction movement. Even most of the countries all over the world are decided to close their borders and postpone their airline service due to the COVID-19 pandemic. Social well-being or safety measures through lockdowns can control the spreading of infections. However, when such safety measures are excessively strict, they can have a negative impact on the developing tourism industry. Some of causes that can contribute to this impact is the human-animal contact through explorations of mankind, petting zoos and tourist parks, rural area accessibility, different behavioral patterns, and the development of travel industry that cause deforestation and urbanizations. First of all, as mankind has become more advanced in travelling technologies, the movement of people in large number across greater spans of land each day has vastly increased exposure amongst humans as well as animals. Interestingly, when people think of animals in contact with humans, sometimes the animals seen around homes on a daily basis, such as birds, domestic pets, and rodents come to mind. In some cases, however, more exotic animals have also come in contact with humans and have increased zoonotic risk in recent years, such as South African lions that are bred on farms for commercial uses, including tourism. On this farm, interactive tourism activities including petting of the cubs, as well as other use of these captive lions, such as slaughtering them for trophy hunting or medicinal purposes. Because increased direct contact and zoonotic risk with big game animals previously kept rather separated from human interactions. Other than that, one aspect of tourism and zoo life that promotes the risk of zoonosis is the concept of petting zoos and tourist parks. Interestingly, it creates a zoonotic risk factor that is similar to one of the driving factors of deforestation, which is the relocations of animals normally in high canopy locations at suddenly being at ground levels and thus in closer proximity to humans. These types of attractions have placed humans in direct contact with animals through petting and feeding, including the now popular way of taking close selfie with animals. The desire of people trying to obtain the best social media posts has encouraged a blatant disregard for the rules, including Instagram posts of visitors feeding animals that are not meant to be fed, having direct contact, or having proximity less than the minimum restrictions. Then, rural area accessibilities enable contact with local zoonosis as well as an introduction to infectious agent in a setting that is considerably different from an epidemiological point of view. Disease may be severe when a pathogen is introduced into a population that was previously naive in regards to exposure. For example, the arrival of European explorers in the Americas at the end of the 5th century introduced diseases like measles, tuberculosis, influenza, and smallpox, which common in Europe but were unknown on another continent. Following that, tourists who adopt its own behavioral patterns in their destination country might be at increased risk of infections because of different habits in regards to the preparations of food and to clothing or accommodations arrangement. For example, the infamous unhygienic some street food in India, the locals are already used to the types of oil and unsanitary water these vendors use. When people are used to E. coli, Listeria, Salmonella from early age, even if they are exposed to them, worst that can happen would be diarrhea. But they can sicken foreigners or in rare occasions kill them. Lastly, the development of tourism industry frequently associated with urbanization's activities of what were previously rural areas, such as road constructions and deforestation, which create close and uncommon contact with wild flora and fauna and potentially with reservoirs or hosts of unknown pathogens. In broader perspective, these human activities are all associated with human migrations and potentially immigrations, as well as with ecological and wildlife habitat change, and consequently have a considerable influence on the emergence and spread of the disease. Now, we move to the topic presented by Husna.
The impact of zoonosis to political system. Health is also linked to the political system of the country. The greatest barrier to the introduction of health innovation are frequently political rather than technological. Decisions about budget allocation, labor policy, technology selection, and the extent to which health services are made available and accessible to different parts of society are examples of how the political system can impact community healthcare. The proportion of GNP spent on health is a quantifiable measure of political commitment. WHO has set a target spending at least 5% of each country's GNP on healthcare to attain the objective of health for all. What is required is political commitment and leadership that is focused on social development rather than just economic success. If poor health trends are to be addressed, the entire socio-political structure in any given society must be altered.
To conclude, zoonosis can be really dangerous to us as it can lead to a pandemic which will impact lots of people and organizations. Therefore, we should learn and also be alert on how to prevent those diseases to spread and even learn to prevent the disease to occur. We believe with everyone learning about zoonosis, it will help in keeping the world safe and secure from any unfortunate events. That's all from our group. Thank you for watching.